Good afternoon, and thank you for joining us. My name is Tina Thibault. I'm the Director of Media Relations for the province. I will be your moderator for this afternoon's news conference. Again, the same rules apply. We are live streaming. Again, similar to the others, we will take questions from the room first, and then we will go to the phone lines. We have 7 reporters on the phones. We will take 3 questions from the phones. We'll start with the Premier. Go ahead.
Thank you very much, Tina. Today has already been, you've been notified there are 5 more additional cases. We have 9 presumptive cases and 3 confirmed, and Dr. Strang will elaborate on those.
So thank you, Premier. So again, we have the total number of cases we now have in Nova Scotia is 9 presumptive, and those are ones at our local lab, and then 3 that have gone to the national lab and been confirmed. So for a total of 12 cases. Since yesterday, we've had 5 more cases that are already active follow-up of the cases, and any of their contacts has started. All of those cases are travel-related or connected to earlier cases. Just to give you some numbers about all the cases we've tested, since as of today, March 18th, we've tested 1,141 and have come back negative, along with the 9 presumptive and the 3 confirmed. And so we have the measures that were put in place earlier this week to calling through 811 and the testing centers are really showing their value. And we fully expected we would get positive cases, and we fully expect to get more positive cases as time goes on. All of the cases together, their age ranges are from between 30 to in their 70s. They are all on self-isolation and doing well at home.
Thank you, Dr. Strang. We're also joined today by Minister Delorey, and the Minister will speak today on some additional health measures that we put in place.
Thank you, Premier. We all know that it's very important to have the available workforce in our healthcare system. So we are working diligently with our partners to expand the available workforce of both doctors and nurses. This includes working with the College of Physicians and Surgeons to waive fees for retired doctors to be relicensed, to make it faster for them to support our healthcare system. We're also working to bring in more nurses, including more opportunities for casual, recent graduates, and retirees. For example, 811 is working to expand services, and to date, 26 RNs have completed their training to support this work, and 70 more are being trained. 811 is also adding 11 trained triage assessors, with 17 more in the training queue. To allow for social distancing in providing primary care services, we are enabling doctors to provide care via telephone and video conferencing where appropriate as deemed by the physician. Physicians who already have access to this technology may begin using it immediately. We are working to establish a provincial system for others who are interested in expanding the use of this type of technology, to manage unnecessary demand on primary care providers, and to support the public health directive to self-isolate. Effective immediately, employers will no longer be allowed to require any sick notes from employees. We are also taking steps to work with our pharmacists to support primary care services. Late last year, we announced an expansion of pharmacy services, including the expansion of services that would be covered by our MSI health insurance. Beginning in January 1st, we were one of the first provinces to provide funding for pharmacists to provide specific clinical services, including contraceptive management, treatment of urinary tract infections, and treatment of shingles. Today, we're announcing that additional changes that will enable pharmacists to better support the healthcare system through this particular pandemic. The first thing we're doing is waiving the requirement that funded clinical services be conducted in person. Similar to with physicians, where preferable and appropriate with the standards of practice and the pharmacist's discretion, they may provide virtual care treatment for those services. In addition, they have pharmacists, the professional authority to renew many prescriptions. Effective tomorrow, we'll be providing pharmacists the fee to provide these renewals. That is ahead of our originally planned April 1st start date. So we're just advancing this work more quickly. And I understand that the College of Pharmacists which is the regulatory body for the profession, has put out a note to the profession to restrict prescription supplies to 30 days unless medically necessary for a longer duration. All of the policy exceptions that I've made or announced to support these specific initiatives will be in effect until the end of June and reevaluated as we continue to manage this pandemic in Nova Scotia.
Thank you, Minister, and also thank you to all of our partners who've been supportive in ensuring that we can provide care to all of our citizens. I also want to thank all Nova Scotians who've been working together and doing their part to slow the spread of this virus by following the public health advice. It's important that everyone continues to do everything possible to keep our loved ones and our neighbors and the most vulnerable in our communities safe. So effective midnight Thursday, personal services, fitness establishments such as hair salons, barbershops, spas, nail salons, body art establishments, and gyms must shut down. We are actively looking at our regulated health professions such as dentists, physiotherapists, and others, and we'll have more information on that in the days to come. Effective immediately, all service providers funded through the Department of Community Services Disability Support Program, including social enterprise, day programs, supported employment programs for adults with diverse abilities, will close to both participants and the public. We will support those families with respite care through our group homes. We understand that people are feeling a lot of anxiety, and today we're pleased to see the federal government announce a multi-billion-dollar aid package that includes direct support for workers and businesses. As part of that, EI had been adjusted for emergency support to offer some of our fellow Nova Scotians. We are working on programs that will complement the federal programs announced today, and we'll have details in the coming days. We will be there for you as we make our way through this challenge. I want to build on something Dr. Strang talked about yesterday. If someone in your community is ill with COVID-19 or any other disease for that matter, they need your support, your caring, compassion, and understanding. I am concerned about stories that I'm hearing about people taking matters into their own hands in terms of trying to identify who may have the virus or who has traveled. None of this is helpful. In fact, it may be extremely harmful. This is the time that we need to be our best selves. This is the time that we need to be there for Nova Scotians. We need to be kind, caring, and compassionate. Before we open up to the questions, Dr. Strang will have a bit more to say.
So thank you, Premier. So I think some of what may be feeding some of the concern in communities about this individual or that individual being out and about and maybe they shouldn't be is some misunderstanding. So just give me a few minutes I want to explain a bit more what we mean about all these social distancing and self-isolation. So all of us need to be social distancing. Doesn't matter where we've traveled. We need it. Now is the time for us to. We call it social distancing, but really it is physical distancing. How do we actually physically get away from each other, so reducing the chance of the virus being transmitted? So that means things like, for as much as possible, working from home. It's why we're closing down so many things. We're closing down, so we're minimizing the chance of groups of people getting together and spreading the virus. So that's something we all need to do, is that physical distancing. But it's also a time where we actually probably need to more be socially connected with each other, because this is a difficult time. So let's use the time I'm going to suggest the free time that now people have, using our devices, using the telephone. How do we connect with each other more? So we're looking ways to support each other. but it's important to understand that this social distancing doesn't mean that people can't be out if necessary. People still need to go get groceries. We need to actually, people who aren't on self-isolation, how are they supporting others who do need to be isolated, whether they're self-isolated because of travel, or maybe they're a senior or somebody who's immune compromised who needs to be more important that they stay home. So those people can still be out and about doing those essential kind of pieces. The next layer is people who have traveled and have been asked to self-isolate. It doesn't mean that they have to stay away in their home. They can, if you're in self-isolation just because of travel and you're feeling well, you don't have any symptoms, you can still take your dog for a walk, go for a bike ride, take your kids to the park. What's really important is that people are separating from each other, but you don't have to stay 24 hours a day behind your door in your home. The next layer above that is people who, once we have a case, we're going to identify who they have been in close contact with, which we're doing with all our cases. Close contacts of a known case it's more important because they're more likely that they've actually been exposed and are going to come down sick. It's even more important that they are more vigilant about separating from others and need to stay more in their homes. The last layer is people who are sick and are known, either they've tested and they're symptomatic and they've gone to be tested and they're waiting for the test result, or they've got the test result back and they're positive. Those people need strict home isolation. So they should not be out and about. Even within their home, it's very important that as much as possible that they're separated from other people within their home, in a bedroom if possible, with their own bathroom. People who are coming into close contact with them, that the person who's sick should, if they're able to get a mask, have a mask on, really careful hand washing and cleaning in the home. So it's this progressive layer of distancing from all of us doing social or physical distancing all the way through to a case who is strictly self-isolated within their home. We're going to have materials that are being developed to help explain this, words and graphically, up on our website. And I think it's really important that we wanted to take the time to people understand what we're meaning, but I think it's also feeding into some of this anxiety that my neighbor is out and about, and I don't think they should be. Thank you.
We'll take questions. Go ahead, Joe.
Dr. Strang, 12 cases, is this roughly where you thought we would be at this stage in this pandemic, or are we doing better or worse? What's your sense?
So I don't know if I had any specific numbers, but certainly if you look at you get one or two cases, and then you start to see more and more cases building. So you look at our epidemiologic curve, we're starting to build exactly what we would expect to see, especially because now we put the things in place. We have more and more people, because of federal government direction and people choosing to come home earlier, more travelers coming. They're getting sick. We're testing them as appropriate. Fully expect to see more come with March break coming next week. What we're hoping, and the reason we're pushing all the things we're doing around personal preventive measures, all the social distancing and restrictions of gatherings, etc., is to limit how rapidly and how high that the curve will be. We know we're going to get more cases, and we're trying to limit how rapidly that climbs and what the peak is.
With that, Dr. Strang, 12 cases, they're self-isolating. Through your investigation and the investigators, how many other people from those 12 are being asked to self-isolate as a relation to proximity and contact?
I don't have all the details on the most recent cases, but what I do know so far in all of our cases, there's small numbers of contacts, fortunately.
Number of an idea of the bubble of people around them that are having to self-isolate?
It's a handful of people in each of the cases. I don't have all the details yet on the most recent cases. They're being actively followed up today.
We certainly understand the flattening the curve and the importance of that. This morning, Governor Cuomo in New York said without that further flattening, the peak would be in about 45 days. Is that your understanding?
You're looking around, we're probably, it's a 6 to 8 week period in all likelihood what we're seeing. So that 45 days is within that range.
He also had very frightening numbers for the state of New York. Granted, a different country, a different jurisdiction. Around ICU numbers, they have 37. They expect 37,000 patients in ICUs, and they only have 3,000. Do those numbers? Is there a parallel with Nova Scotia?
I haven't seen any of the details of New York. We do have work going on right now trying to do some modeling to try to predict what may be the impacts and the needs in the healthcare system.
Will that be made public?
When we have that, there's active working on doing that. I'll finish off by saying we are fully expect that this is going to have a significant impact on communities, a significant number of people being made unwell, significant impact on our healthcare system. Everything we're doing is to lower that impact as much as possible. And so that it's important that we're putting these big impositions on people's lives, on businesses, et cetera. But the reason we're doing that is to reduce the impact on our health, on the people's health, protect people as best we can, preserve our healthcare system.
It's also why, if I can, why Dr. Strang and his team have been out with public health talking about if you've traveled at all, self-isolate for 14 days. We can't prevent this virus from coming here, but we certainly can slow down the spread. If you look at jurisdictions, some of which you've talked about, that spread had already started to take place before the public health had put in the initiatives that Dr. Strang and his team have been talking about. That's why it's absolutely critical to prevent the kind of things you're referring to from happening here, is that people need to take this into their own hands and understand the severity of it. And self-isolate. If you've been out of our country, come home and self-isolate. And if you start seeing these signs, call 811. That's the best way, and that's the only way I believe that Nova Scotians, that we're going to be able to actually make sure that we get to that flattening the curve much quicker than other jurisdictions have.
Given the community, the 12 cases and the measures that we've put into place, we do know there's an influx of people coming back from the U.S., snowbirds, the like. Are we staying ahead of this at this point? And secondly, what's the concern around community transmission now moving forward, given the amount of people that will be coming back? Maybe a question for you both.
So the way we stay ahead of this as much as we can is everybody coming back self-isolating. So we put additional steps into the airports in the last couple of days, not relying just on the information from the Canada Border Services Agency, but as well as provincial inspectors. It's really important that all Nova Scotians who coming back into the province after being out of the country are aware of the information, and it's critically important that they stick for the 14 days with that self-isolation. That is what's going to make the difference. The other piece is that the effect of limiting large numbers of people getting together, when you do get community spread, if there is a situation, the numbers of people who might have been exposed are going to be small if we're really adhering to this under 50 people, if at all possible. That's the key reason why. So we don't want. That's why we're shutting down bars. We don't want a case in a bar of 200 people. Rather maybe they're at home with 10 other people. Makes a huge difference of how rapidly and far it spreads by limiting the number of people, even when somebody becomes sick, that they're likely to be in contact with.
We've closed a number of types of businesses and limited gatherings. There are other businesses we know that have not closed. I'm wondering if you can offer some clarity on who exactly should be physically going to work.
So as much as possible, we're asking businesses and employees to work virtually. That's not possible for everybody. We are closing down a number of businesses, but we also know a lot of employees are already doing this, working from home if possible, or closing on their own accord. If people are open, and we do have essential services, gas stations, we've allowed restaurants to be open because people need to eat, those kind of things. We're really working with them to show how do they run their essential services in a way that protects the people as much as possible, limits people coming together, facilitates people, if they are in a business or an environment, at least that's 6 feet apart, lots of hand washing. So I was at a meeting this morning with our court systems. When the discussion was, how do we run some of the essential services of our court system which you can't shut down completely, but what you do need to keep going, do that in a way that is as safe as possible.
Go ahead, Shayna, you have a follow-up? Go ahead.
If employers are not allowing their employees to work from home, to do that virtual distancing, what kind of recourse do people have?
I think you're getting a bit out of my territory here, but I mean, employees have need to have that conversation. How do they be safe? I think the vast majority of what we're seeing is a lot of people are being responsible. And I think some of the things that the Premier referred to around the federal government and provincial assistance financially helping people manage so they don't have to be at work are important tools to allow people to stay home unless they absolutely need to be at work.
And we were also seeing some of the services that we had talked about, for example, barbershops, cosmetologists, they were using this social distancing where they were reducing the number of people that were coming in over the last number of weeks, sitting in their waiting room and area. It just became to us that we assess all of those as an ongoing basis, and it became now that this was the next phase for us to say these businesses must close. Because really what we want to do is keep people, and we want people home in their own area, their own property, doing staying with their own family. That is, one of the ways that we're going to prevent this spread, and we will, on an ongoing basis, be looking at who's open, who's closed, what's happening, and you don't be surprised, each day or 2 days that we identify another sector of our economy that's going to have to close.
This shipyard is almost entirely funded by government contracts. There's something like 1,300 people working over there, and yet they're continuing to work. Can you address that?
Yeah, so obviously it's a national government site, but we're in contact with the national government to ask what is happening on that site.
Premier, are you any closer to considering calling a public health emergency in Nova Scotia over this?
Well, currently, with the advice of Dr. Strang and his team, we now have an order that provides us to do the kinds of things that we believe are necessary. And I would say to you, all of our partners, from the unions to different organizations, have been very supportive and receptive when Dr. Strang has made an order or worked out looking for their help. They've responded very positively. So we haven't seen that we needed to go to a health emergency at this point. That doesn't mean we don't assess it and talk about it, but that'll be something that, with the support of public health, if we need to, we will do that. But right now, our partners and the business community, everyone, is helping us to ensure that we get we slow the spread of this virus in Nova Scotia, and I'm very proud of them, quite frankly, through all of the differences that we may have with one another through the daily routines of governing and all the other stuff. In the midst of this crisis, in the midst of this virus, it's united us in a positive way.
Given all that the three of you said about being responsible and keeping people safe, what's your rationale for keeping liquor stores and cannabis stores open? Because I don't think many people would consider those essential services.
No, we will continue to analyze those and assess those as we go along. It's not a place where we would see large numbers that are showing up at them. We saw people, there was a bit of a run on that people felt, I think we were going to close them. It's not the case. We saw what happened when that rumor was out there. And if you look across rural Nova Scotia and across Nova Scotia in general, we've changed the hours. They'll be continually assessed. And if we find that is a public health issue in terms of spreading this virus, then we'll take further steps.
We'll take two more questions before we go to the phones. Go ahead, Jesse.
Thank you. Will you look to bring legislature back on kind of an, an emergency basis just to enact any of these new bills or anything we need to do? Or how's things working?
So we would if we required, but as you know, we had our budget through, so our spending power is there now with the Minister of Finance and Department. The national government may need to call back Parliament for these EI changes they're looking at, but at this point we don't see needing to call the legislature back to make the kind of adjustments that we want to do in the coming days. But I will say this, there's been tremendous support by all political parties and leaders in the province and our partners, that if it was required and was in the best interest of and required for the public health of Nova Scotians, we could call it back very quickly and deal with anything that we had to.
Mr. Delorey, how many doctors in this province already can do telemedicine today?
I don't have the exact number. I'm really the EMRs I've spoken about previously, the electronic medical records, the software they use in their offices. Most physicians upgraded their software in the last 18 to 24 months. And as I understand it, the two technology platforms that rolled out both have an add-on functionality that if they were so inclined, they could enable it and begin using. So I don't have the exact number on the breakdown. I'd have to get back to you. The number, all of them have access to a platform. We're working to get a provincial platform, though, for those who aren't comfortable setting it up in their own office. So there are those who are a little more comfortable with the technology. I don't have the breakdown for them, but it's also important that that's for the video conferencing side of technology. The telephone functionality to be able to do remote services that way has also been enabled, and all physicians can provide that service right away. And as I said, with the technology, those who are early adopters and are more comfortable with the technology, they're able to do that. They would know the platforms, and we are working on a strategy to have a provincial platform to support the other physicians who might need a little more assistance.
We'll take one more question before we go to the phone lines. Go ahead, Shayna.
For the Premier, how will federal EI and benefit payments affect people who are on social assistance? Is there any possibility that those people could somehow lose benefits down the road because they're sort of bumped above an income bracket?
No, most of the EI changes would be for self-employed and those employees losing their jobs. What you would see potentially on social assistance that came out of the program today was the increase in child tax benefit from the national government, which is putting money directly in the hands of those families with children. And we ourselves will have more to say about income assistance recipients here. But what you're raising is, which was raised actually on a call today with all the premiers across the country, the message to the national government, whatever assistance is provided, let's not have it clawed back. That's a big piece because every province is looking at how can they best support their workforce and best support not just vulnerable citizens in the workforce, those who need our support, but everyone, because at this time a lot of people are losing their jobs in whether it's in the arts sector or in the service sector. We want to make sure that if we provide a one-time assistance or for a period of time, that the national government does seize an income and claw portions of it back.
No clawback.
Well, that's what we're working for now with the national government to make sure that that's happened. It was raised by a number of premiers across the country, and we supported that position.
We'll go to the phone lines now. We have time for 3 questions from the phones. Go ahead. Do you have a question?
Hi. Yep, it's Matthew Moore from News 95.7.
Great. Go ahead, Matthew. Go ahead, Matthew.
Yep, supplies in hospitals, just a quick comment on that, how we're looking, and then just a quick follow-up. What's being done for home care workers? They're obviously frontline workers that are dealing with a lot too.
Staff continue to engage throughout and our partners throughout the health system to work with them to ensure that they're able to safely provide their care. We have to recognize the fact that many of really the people receiving those services are some of our most vulnerable populations. The equipment, the Nova Scotia Health Authority and the IWK continue to evaluate, and they move through their procurements. I think we've talked previously about some of the specific items like ventilators and some other personal protective equipment. So those procurements are working their way through.
We'll go back to the phone lines for one more question. Go ahead. Do you have a question?
Joan Baxter, freelance.
Go ahead, Joan.
Yes, Dr. Strang, I'm curious about the rationale for not naming the events at which people may have been infected. If these were public events, surely privacy shouldn't really be an issue. And if you named the events, couldn't you save yourself some shoe leather by the people who were in attendance would get in touch with you, and then you would save precious time and resources trying to track them down. And I think it would reassure people who might have been at those events Also, they wouldn't be really nervous and bogging you down with inquiries about whether or not they might be infected.
So I don't think I've ever said we wouldn't. What we do in our follow-up, if there's an event where there's a group of people have been, if we can contact all the people who were at that event, people who might have been exposed, if we can do that in a direct way that respects people's privacy and doesn't require us to with a big public announcement, we will do that. However, and we've done this before. You see public health. If you have a restaurant with a foodborne illness or something, if there is an event with an exposure, and the only way to try to get people to come forward who might have been exposed is to do a public announcement, we will do that. So that's standard public health practice, but we only do that if necessary.
Thanks, Joan. We'll go back to the phone lines for one more question from the phones. Go ahead.
MAJ. Bill Martin, Six Rivers News.
Go ahead.
Yes, a press question for the Premier. Mr. Premier, tonight the Cumberland Municipal Council is meeting in a regular monthly session, but citing virus concerns, they've banned the public and the media. Is this appropriate?
Listen, they would have made the decision based on how they're feeling in their particular community. I don't know the circumstances around why they would have had an in-camera session there other than maybe distancing. I don't know that chamber at all, but there are many ways that you can communicate what's happening in that meeting, whether it's video or quite frankly, a more public update afterwards. But I think it's important at this period of time that all of us recognize that what potentially might have been a normal practice 3 weeks ago is not normal today, and it's really is important that we do social distancing, and that comes in all of its forms in public events, and we need to make sure that many of us stay home as long as possible, quite frankly. The safest way we can be is be at home with our families, and if we traveled at all, self-isolate. It's absolutely critical. So that council would have made a decision, and I'm not here to second guess them, quite frankly. They'll communicate to their constituents.
Thanks, Martin. We'll come back to the room for two questions. Go ahead, Joe.
Premier, a lot of people are worried about who are self-isolating or doing what the government wants them to do in terms of keeping away from others, still have rent to pay and no income. So what is your government doing for those people?
Well, part of it today, that's part of it. We were pleased to see the national government in and around the EI changes with emergency funding, which is an important one. We wanted to see the full suite of things the federal government is going to do, and in the coming days we'll make some announcements around how we can dovetail into that to support those individuals.
Premier, have you been in contact with any farmers? Is there any concern that there will be enough workers coming to Nova Scotia in the upcoming season?
Certainly the temporary foreign worker situation is a challenge. It was a big topic on the phone call with the Deputy Prime Minister today. A number of provinces who rely on those, particularly in the agricultural sector. Quebec here in Atlantic Canada, three of us for sure. So we're working our way through the national government, and Minister Caldwell's also working with programs that we have to identify is there a way that we can use the student population that's out working, or quite frankly support those who have lost their jobs in the service sector to be able to support, whether it's in this current planting season and then they may go back to their full career later on, but if they're unemployed today, how can we create a program that will help support them to ensure that we get some of these plants in the ground, because strawberry plants are on their way. And they will be required to be in the ground, otherwise we'll lose them. So we're working with the national government about whether or not we will actually be able to have workers come in, and further off, how do we create our own program internally to be able to support Nova Scotians who may be finding it difficult right now, that we can use them in this the agricultural sector.
Like when that, I know it's early, but like when you might have that finalized, because as you mentioned, you're kind of up against the clock for planting a lot of
So we were working on a couple of things, so that there's obviously some the social side of the equation for us that we're going to have to provide some support on. How do we directly make sure that people can afford to, they can meet the rent, the issues around evictions, all of those are pieces that we're working around. How do we ensure that people can who are on fixed income assistance, how can they support and feed themselves? That's an important piece. We're working, and we'll put a package around it, and then we'll have a package around the economic side, which will include the agricultural sector and other sectors, and how do we best support them and the businesses that are in it to help weather this, to get us through it, because I think we know we're in for a crunch. This is Dr. Strang has said many times, we're 6 to 8 weeks potentially here, and how do we make sure that we keep people okay, and then prepare them to help move back into the economy of our province.
Last question goes to Jesse.
Question for Dr. Strang, for my colleague Lexa McLean. She's looking at the vulnerable population, those in homeless shelters around the area, with social distancing practice and things like that is making some real pressure situations. What's being done, I guess, to address this and help keep those populations safe?
So within government, there's both the deputy ministers of community services and municipal affairs and housing are leading a process to develop a response plan, working with the shelter organizations to address all the issues as best we can that you've identified. They're very vulnerable populations, so what do we need to do to try to give them the support that they need to maintain the social distancing if somebody needs to be self-isolated? So that's a very active piece of work that's underway, led by government.
What about the prisons? Jail.
There's the Nova Scotia Health Authority, Offender Health Services is working closely with the Department of Justice on issues around related to corrections as well.
Thank you
We're
very
working
much.
to make sure there are no visits into those corrections. They've already been canceled, as well as, and remands on the weekend. Those are being actually dealt with in another way within the system because of, quite frankly, that's how that virus moves into that population. So again, thank you all so much for tremendous support. I do want to tell you, Dr. Strang and his team has done a tremendous job. And I want to thank those Nova Scotians, quite honestly, who've continued to follow his advice, which is self-isolate, good hygiene, continue to make sure that we continue to look after one another. And instead of identifying who may be isolating or who may have been identified with this, find out a way at how you can support someone in your community who may require groceries, may require your support to get to and from an appointment, or quite frankly, just may need a phone call from you. Everyone is anxious, everyone is nervous in different levels, and just reaching out and being kind will go a long way to helping reduce the anxiety that all of us are feeling.
Before you go away, just on the remand question, so people aren't going in on the weekends anymore?
Any ones that we can prevent from going in on the weekends for remand is not.